This is Jerry O'Sullivan. I'm the Chief Medical Information Officer at Wirral University Teaching Hospital Trust. Today I'm going to show you how to discharge a patient using the present Wirral discharge process. This is our patient, and for the purposes of today we'll assume that they have got recurrent acute tonsillitis and that they have just had a tonsillectomy, and I am in the process of filling up this discharge summary from a medical point of view in theatre before next patient is brought in for their procedure. So the first thing I do is I add a diagnosis, and that's quite simple. Putting in part of each term allows the diagnosis to come up quite quickly. So double clicking on this, confirm diagnosis, it's the primary diagnosis, and we click that as OK. I'm now going to add a procedure, and I am going to create a bit more space here. I'm going to my favorites, and I'm going to do procedures of the throat, and I'm going to click on tonsillectomy. I'm going to date it, time it, bilateral, and OK. Both these now should pull through to the discharge summary. Next thing I need to do now is go to the depart process. I'm now going to do the medical part of the discharge. I'm going to go down to the compulsory fields, first of which is management. There is no secondary care plan. And the primary care plan is nil. No medications have been changed. We haven't started anything else except analgesia. Everything has been signed and sorted beforehand, and the patient certainly hasn't had an AKI problem. Then complete it. I pick my own name, and then we need to come up here to these two buttons. These are very important. The green tick is to sign and finalize the form. If for whatever reason I wanted to come back to it, I would then save this form to be completed, to be altered, and to be finalized at another stage. But today I've done what I needed to do to discharge this patient safely, so I'm going to finalize the document by signing it using the green tick. And that effectively completes the medical section of the discharge power form. The medical power form has now fed all the entered information into the final document. However, it's not complete. The nurses haven't completed their section yet, but we can certainly look at what we've done so far. So to do that, we can view the document. I've got a diagnosis, procedure, I've got presentation, I've got management, I've got a secondary care plan, and I've got a primary care plan. What you will notice is that only the fields that have had the information entered show up in the discharge summary itself. I will now pause the video for a few moments whilst I complete the nursing section as if I was a nurse, and then I will re-enter the form again, and I will alter it as if I was making an amendment after the patient had been discharged. As you can see now, all sections of the discharge process have been completed and the document has been finalized. During the nursing process, the document would have been printed a number of times so that a copy would have been sent to the GP. I'm now going to close the document, but before I do that, I'm going to show you what it looks like. I don't particularly like this, it doesn't look particularly professional, so I'm going to redepart the patient in a few moments, and I am going to change that. All the nursing comments have been pulled in, all the various alerts, etc. have been also pulled in. And down here at the bottom, I am both the consultant in charge, I'm the clinician who's done the discharge summary, and I'm also the nurse who's completed the nursing section. I'm now just going to close it, and we're going to re-enter the depart process to show you what to do next. So I'm going to go up here again, and I'm going to enter the medical section of the discharge summary. I'm going to remove these comments. I'm happy with the rest of it, so I'm going to finalize the document once again. That now completes the medical power form. This is the discharge summary. The comments have been removed. It's good to go. But this process is slightly different for the doctor second time around. First thing you need to do is you need to click print, which prints 2 copies. One of these needs to go to primary care through whatever mechanism you already have in place. So I'm going to do that immediately. And that's now printed 2 copies to the printer that I've already chosen. I'm now going to click save. By pressing the save button, I am sending the discharge summary electronically to primary care. And that completes a tour of the discharge process and the redepart process. Thank you for listening. Thank you for watching.